If you are someone who is seeking information on bone marrow transplant or someone who has been diagnosed with a condition and recommended by a doctor to undergo a bone marrow transplant treatment, then this video is for you. So, hi, I'm Sunidhi and this is Urvi. Today we are here to talk about bone marrow transplant and why it is important to take a second opinion before you undergo a bone marrow transplant treatment. So, in recent years, the treatments for blood cancer and disorders have advanced, and bone marrow transplant is a fairly advanced treatment method for such conditions. So I would like to start by asking a very basic question that what is BMT and what are the conditions for which one should undergo a BMT?
So yes, so bone marrow transplant is an effective procedure, and that has been found to be safe for various blood cancers like leukemia, lymphoma, and even blood diseases like sickle cell anemia. In this particular procedure, healthy blood forming stem cells are infused into the patient's body in order to replace the bone marrow that is unable to produce healthy blood cells. So these healthy stem cells could be obtained from the patient's body, and this is called as an autologous bone marrow transplant. Or these could be obtained from a donor, and this is known as an allogenic bone marrow transplant. But for an allogenic bone marrow transplant to work, the donor should be genetically compatible with the patient. And in recent years, there has been a lot of advancement in this field, and further research is also going on.
Okay.
And apart from this, I would also like to mention that bone marrow transplant is not a surgical procedure. In this particular case, healthy blood stem cells are directly fused into the bloodstream with the help of an IV catheter or vein. And from there, the stem cells will directly migrate to the bone marrow, and they will then form the blood cells, and thus helping in restoring the ability of the body to, fight off the diseases and infection. But the thing is that though this is a very advanced procedure and all, you should always consult with a hematologist to determine if it is the right one for you. Only a hematologist and a professional can tell whether this procedure will work for you or not.
Okay, so as you have already said that it is a critical procedure and it is a fairly advanced one too. So how can patients be sure that it is the right one for them and it is safe for them?
I think since every procedure has its own benefits and risks, so the patient should thoroughly discuss the risks and complications associated with a marrow transplant with the hematologist as well. So, there are many risks to the procedure like infections, and a graft versus host disease is also possible in case of those patients who have underwent an allogenic or bone marrow transplant. So, in this particular case, the immune system that is formed from the donor stem cells begins to attack the host, or the in this case the patient's organs and tissues. So this condition could be even critical and very serious.
Okay.
So the patient should discuss all these things with the hematologist before opting for this particular procedure. And if they feel like that this procedure may not be the right one for them, then I think if they're confused about it, then they should definitely get a second opinion.
So when is it ideal for a patient to go for a second opinion, and what are the questions that they should ask themselves to be sure that they should now go for a second opinion?
So, in any point of your treatment journey, if you are not satisfied with the results of your treatment, and you're not very confident about your diagnosis also, then you can go for a second opinion. But you should always try to get a second opinion from an expert, a specialist, someone who has expertise in treating blood disorders and blood cancers. And if you want to make be 100% sure that you need a second opinion, you can ask yourself certain questions like, is my current doctor giving me all the treatment options, or do I need to explore others? Does he or she have the required expertise, experience, and
Right.
qualifications to perform the procedure? And if there are other options that I should go for, and if suppose the patient is unclear about the diagnosis, then also the patient can go for the second opinion. And sometimes there is a lack of communication also between the doctor and the patient, so the patient should really ask that, is the doctor answering all my questions clearly? Am I comfortable enough to ask all my doubts and all? So after considering all these things, if the patient asks these questions and feels the answers indicate that a second opinion may be actually required, then I think in that situation the patient can go for a second opinion.
So there is a level of hesitation among patients when they have to seek a second opinion, and factors like traveling long distances or standing in long queues in the doctor's office, they are all a
Hmm.
potential barrier. So how do you suggest that the patients can leave this hesitation behind and still go for a second opinion?
Yeah, so you rightly pointed it out that many patients, they feel hesitation when they're thinking about going for a second opinion. They feel like that they're betraying their primary doctor by doing so. But the thing is that you and your doctor are in this together. Like you should be able to work as a team for, to provide the best treatment. But
Hmm.
if you feel uncomfortable and you are not sure about the treatment, then it's your right to get a second opinion, and you should not feel any
Hmm.
hesitation about it. Like if you're searching for another doctor who can give you a second opinion on a condition, then you can ask your friends or family, and you can read reviews online to find a good hematologist. But the thing is that like try to ensure that the hematologist has good amount of experience in performing bone marrow transplants,
Hmm.
because in that time only the hematologist can tell if you're the right candidate
Right.
for the bone marrow transplant or not.
Hmm.
So like yeah, you can ask around and search online as well. So after considering all these things, I would also like to mention that with Medigensis Think Twice, it is also second opinion platform, and here the patient just has to upload the medical records and the results of diagnostic test, and there is a hematology board which will review the
Hmm.
the symptoms of the patient, the diagnosis and the treatment options that have been recommended,
Right.
and based on that, the board can tell that whether the bone marrow transplant is a good option or not, and if
Hmm.
other treatment options are possible for the patient. And the best thing is that you just have to submit all this information online. Like you mentioned that many patients have to
Hmm.
travel and all, so that kind of restriction won't be there, and
Right.
the second opinion report will be delivered within a few days,
Yeah.
so a patient can make a quick decision also about their health.
So you are right, it's a convenient method. So to conclude this, I would like to say that bone marrow transplant is a revolutionary procedure for blood disorders and blood cancers. But I would also like to point out that it is not the only line of treatment, and it is usually not the first line of treatment for blood disorders preferred by the doctors. So if you are someone who is undergoing a bone marrow transplant treatment, or who have been recommended to undergo a bone marrow transplant, you should know that bone marrow requires a long isolation period and recovery time, and due to all these reasons it is just and you must go for a second opinion. If you want to go for a second opinion or a third opinion, we have a platform called Think Twice, where we can connect you with expert panel of doctors, hematologists and bone marrow transplant experts from around the world. Reach out to us to know more. Stay tuned, and thank you for joining us. We'll come back again with another video.